Thank you. Just a little bit more about this program, because I think it's important to contextualize what we mean by partnerships here, and it really was the seeding of our work on partnerships. So the SDC funds nearly 3/4 of the 100 million over 10 years that have been put into this R4D program, Research for Development, and the SNF, the Swiss National Science Foundation, has put in around 25%. And I would strongly argue this is really more than a financial arrangement. And they really wanted to sort of think about the challenges that we face right now. In a way, it's experimental. I think we've all been, who've been part of the R4D program, have become aware of how experimental it is. But it also brings together very different, and I hope complementary, cultures of work and activity. Academic research, of course, on the one hand, is defined by its methodology, by its development of theory, by its contribution to knowledge. The ways in which SDC and development agencies and the development industry, you might say, in some way, operates is to make visible its programming, to make visible partly its investments in programming, and has somewhat different managerial practices than we have in academia. In academia, we're measured simply by our publications, and in development, our measures are rather different. They often involve things like, we love them in academia, log frames and theory of change, and things that were actually rather new to us as academics coming into this program. So I think this partnership is fascinating, but it's the bedrock of our research project. It's where it came from, and it has its challenges, and it has its amazing opportunities, which I think we have striven to take advantage of through the last few years. So the second element of partnership I wanted to explain is about the researchers. Now here is the logos of many of our partners in one way or another. Now you can imagine managing these partnerships is complex. And in fact, in the R4D program, the Research for Development program, transboundary partnerships have been a key component of the ideology and the philosophy behind bringing these two cultures of research and application together. Now, in fact, so much so, and I'm an anthropologist, I'm interested in ideologies and knowledge performance and knowledge creation. In fact, at the very outset of our R4D exchange, we were handed a very useful set of guidelines that have been developed on transboundary research collaborations. And I won't read through them all, but I think we can all agree to some extent these are principles and values that are fundamental to successful partnerships and collaborations. So I would say from an anthropological sense, we actually have an ideology coming up here. We have a body of knowledge as well that is supporting the idea of partnerships. I think, though, our most innovative component of partnerships is that we took it a step further. We took these lovely principles and we started to think, what would that mean as a methodology? Partnership was the seeding of our project from the very beginning, from the funding. Partnership goes beyond just us as researchers and institutions getting together. But what's the partnership we have with the communities in which we are conducting our research? And it's this that I think is where we have been trying to innovate further, and that brings us to this morning's discussions and interventions later on the panel discussion. So we've developed what we describe as a people-centered and co-created environment, and I'll tell you a little bit more about that in a while. Ultimately, it's participatory research, but these pictures are from the 3 different countries where we brought together community leaders, community household members, people who are working in the health systems locally, and we talked to them about what the challenges they were facing and what their experience were of the health system. We used different types of methods in different countries, obviously 3 very different settings. Nepal is very experienced in conducting household surveys, so they literally go out very much into rural areas, into households. In Mozambique and Peru, activities were organised within the communities, but jointly organised. And I think this is quite interesting. We have written about it, we've written up this methodology. And I put there, people-centred and co-created equals partnered and LNB, which is leave no one behind. So it's sort of turned into an acronym these days because, of course, the SDG agenda says to leave no one behind. And I think only by working really at community level, really understanding at a deep and even ethnographic level, can we ever secure, to make these relationships and this research about partnerships and partnerships with other people. So that really sort of summarizes, I think, the 3 areas that I wanted to particularly talk about, just to give you an idea of what this methodology looks like. And of course, being from the academic side, we are particularly keen on developing methodologies and theory. It's not so clear, perhaps it's a little bit small, but basically we developed an iterative process of going back to the communities, going back to the people working in the health systems, and engaging in different activities that were in them of themselves data collection moments. So everything we did was very much working back and forth in what we'd like to think, we hope, was a co-created, co-narrated research engagement. Just checking time. And so we have begun to publish some of this, and of course, partnered outputs are another component of our partnerships, and we've begun to publish these in our collective, in our research collaboration, and also working with others in other sectors now as well. We've increased and expanded our collaborations and partnerships beyond just that of our Cohesion Research Project. I think I shall leave it there, except to say a few things because I realise it's already 1:45 and I'm moderating, so I should actually be in charge of time more than anything else this morning. But I guess what I'd like to say is that, in a sense, the partnership is a set of values. I think we pushed it a little further. We tried to turn partnership into a methodology, a way of doing things. Several of us have had experience in working in design and more innovative settings in other sectors, and brought that to bear. Now, I wouldn't say it's always easy. We're all human beings, and actually, ultimately, partnerships are not about institutions. They're about the human beings that are the glue and the fluid that moves between the institutions that allows these things to happen. And so I think we need to work further with these, and we need to resist very much the temptation we all have to retreat. Sometimes we retreat to our disciplines. I always retreat to anthropology. Sometimes we retreat to our institution or our ways in which we're familiar with doing things. It might be the theory of change, or it might be a household survey, but we sometimes retreat. And actually, in order to have true partnerships, to really advance knowledge, we have to engage in those partnerships and be adaptive and open to change and critical reflection. So I'll leave it there. That's what we've done in Cohesion. That's the setting of today's our day-long event, in fact. Just so I'm keeping an eye on time, as it's my most important job this morning. Someone who knows, we invited a keynote. Someone who knows a lot more about co-design and co-collaboration than I do. Severin von Hünerbein is, actually you have some great job titles, I love them. So he's a Catalyst Lab co-designer and a co-host at Collaboration Helvetica. And I love this one, Euphoric Business Enabler at Euforia. And his work is in line with some of the things that we've been doing, I believe. It focuses on co-designing, facilitating, and implementing collaborative and inclusive research and learning formats. He works in higher education, in institutions, NGOs, with change makers, business and international organizations. So very much a partnered approach. And he's here really to inspire us to keep thinking out of the box and keep thinking about how we design and how we think through innovation in global health. So please, I welcome you to come and replace me. And you have some slides for a presentation. Then we will move on to the Q&A after Severin's given his his presentation. So, thank you.
Sorry, so it's a bit of a disconnect.
Okay, sorry. Yes. Well, you can start. Wait, we will have a Q&A afterwards, so please do start to think some questions after our keynote. It's always a moment when you turn to the floor. And after that, there'll be a coffee break, so you can hold on to that. Thank you. Super. Thank you, Severin. Welcome.
So the PowerPoint is collaborating. That's good. Good morning. It's a pleasure to be here. And I would like to talk about partnerships through the lens of collaboration. And the title that I chose and that David and I discussed for this keynote or this talk is Radical Collaboration for a Co-Created World we want to live in. So also setting the outset of why do we collaborate? Why do we partner? What's actually behind that? And I'm here to represent two organizations. One is Collaboratio Helvetica, and the other one is Euforia, that actually sits here in Geneva, that was founded here. I personally live in Zurich, and I do work in Switzerland, but also internationally. And I'm going to talk a little bit about how we do things. So it's a little bit of theory, but also I try to give practical examples along the way. So kind of the framework or the outset of why I do the work or we do the work that we do is clearly achieving the SDGs. So there are different ways of framing that. The SDGs, they provide a language, they provide specific goals. It's commonly known, the Agenda 2030. So it's just a useful framework to use and to address. And I assume you're familiar with that. So, we want to create a future that we want to live in for ourselves, but also for future generations. So this is really the work we do, is achieving the SDGs. However, there are many challenges, and for those of you who are familiar with Theory U, that was developed by Otto Scharmer, he's German but moved over to Boston, Massachusetts, to the MIT. He developed Theory U, and what he's talking about is that we're living in a world of massive institutional failure. So he's very direct in that, and what he's talking about is there's basically three divides that you can kind of nail down the failures. So the first one being the ecological divide, or basically what he's saying is we collectively create results that no one wants. And the first one, the ecological divide, can be summarized by the number 1.5. We're currently using 1.5 planets to sustain one planet. And if you translate that to Switzerland or the Western world, it's even much higher. So we're overusing our resource capacity. The second one is the social divide, is between me and you. So currently the distribution of wealth is highly unequal. And there is 1% of global population that has more accumulated wealth than the rest, the 99%. So just the distribution in society is hugely unequal. And then the third one, the spiritual divide, this is interesting for you coming from the health sector, is the divide between me and myself. And the World Health Organization in the year 2000 reported that there's twice as many deaths that occurred as a consequence of burnout or stress or suicide than people died in war. So like the stress level is hugely impactful. And also in Switzerland, I grew up in the east of Switzerland, that is very close to Appenzell. And for those who know, the region, there is the highest suicide rate in Switzerland, even though it looks quite idyllic from the outside. So, you know, we have those SDGs, we have the plan, the agenda point of improving the state of the world, and yet we're not very successful in that. So, you know, we need more innovative and sustainable solutions to tackle the challenges of the 21st century, digitization, climate crisis. You know, there's so many things we can tackle. So how do we do that? And a way not to do it is to do it in the same way that created those challenges. So if we just try to do the same thing in a different way, it doesn't work. So how can we radically change or collaborate radically in achieving those new solutions? And so, you know, when we collaborate or, you know, in designing those approaches, we can kind of look at where are we interacting? Are we just fighting the symptoms, or do we really go down to the root problems? So is it, you know, where are we investing our energy, our efforts in? And I assume many of you have come across the iceberg model in one way or another. So this is also, again, from Theory U. And, you know, if we're just working on the surface level, if we just keep on fighting symptoms, especially in health, you know, if we're just prescribing medicine, it doesn't really change the root causes, the source. You know, like instead of just going on a, you know, on painkillers, how can we change lifestyles? How can we create environments, healthy environments that don't let the problems or the symptoms surface in the first place? So how can we collaborate and create a co-created leadership capacity that tackles this? So we move from an ecosystem where we just pursue our own objectives to an ecosystem. And there you can picture the image of a football team. So, you know, a football team is, especially in the male sports, is usually composed of a lot of ego. So there's a lot of ego in the game. High salaries, you know, who scores most goals, who has the best contract, you name it. And each ego is not successful if they don't collaborate, if they don't look at the team as an ecosystem. So, you know, a defender needs to rely on the midfielder, on the goalie. A striker can only strike if he or she gets a pass. So, you know, like, how can this ecosystem of a team on a pitch work together to achieve their mission? And so, you know, you end up drawing a world together. So, you know, how can we collectively each contribute to that? We don't need to do all the same thing, but really, like, how can we use our individual capacities to achieve a common goal? And our approach very much focuses on the inner side. So this is based on the work of Ken Wilber, a 4-quadrant model that's used in different contexts. So basically, there's an inner side, an outer side. On top, there's the individual level and the collective level at the bottom. Until in our work, we're not so much looking at the processes or how we interact with each other, the systems. So what's measurable, what's visible, but rather on the intangible, on the inner side. Who are the people? So what are my values? What is my place? How do I fit into a context, and how do we treat each other? So how do we trust each other? What's our communication? What's our culture? And this is much harder to measure. And also it's a long-term investment. And it's a huge impact potential and a huge room for improvement, because usually when you look at, okay, what can we improve? It's, you know, processes, it's products, it's the output. And the inner side is never really urgent, and it's always important. That's what makes it really difficult. And I'm gonna present to you method that's called radical collaboration. It's also in the title. That was developed in the United States, in California, by these two gentlemen, Jim Tam and Ron Luyet. And Jim, he was an administrative law judge in the state of California for most of his professional life. And what he saw is that certain parties, they kept coming to court to settle their negotiations or their disputes, and others didn't. So some were more collaborative than others. And what was also interesting is this cost. So the inability of the parties to, negotiate their disputes by themselves cost the state of California a huge amount of money. So there was an economic interest in preventing them from coming to court. So with this question, they received funding from the state of California to find out what makes it that some people or some parties are better at collaborating than others. And they came up with the approach called radical collaboration. And so what they, when doing their work, what they found out is basically there's a spectrum of cultures. So there's a red zone that's highly competitive, that's defensive. There's a hostile environment. People defend themselves. It's me versus you, so it's your fault, it's not mine. They're protecting their own interest. They're a little suspicious and cynic. And work is usually painful. And if people think about work, it's usually a very defensive, or how can I protect myself, or even hurt the other. And then there's let's say the other extreme, that's the green zone, which is the complete opposite. It's high trust, low blame. So what can we do? How can we collaborate together towards a shared vision? How can we support each other in meeting that vision? And people usually take more risks because they have a long-term strategy. They know where they want to go, so they're more flexible in getting there. And work is usually more pleasurable, fun, and motivation is from the inside. And of course, in every team, in every organization, there's not purely red or green, there's a mix of that. But just those two different cultures. And I believe all of us have experienced red zone and green zone. And the message is also in the long run, how can we get into the green zone to have a more effective long-term relationship that's based on trust? Sometimes we need to defend ourselves. Sometimes we need to be in the red zone to protect our interests. And then it's important to go into the green zone again. And the green zone is not the absence of conflicts, quite the opposite. It's how we deal with conflicts. Do we go about, okay, what can we do about the situation? How can we get both our interests met versus it's your fault, I protect myself and I fight against you. And, then over the years, people kept coming to Ron and Jim saying, we don't have problems or we don't fight, so we must be in the green zone. And that's not true. So then they developed the so-called pink zone, which is a hidden red, and the false green zone. And I often refer to this as, like kind of the Swiss zone. We like to stay in this one. It's like, like not really taking a stance. It's unclear ownership. You are avoiding conflicts because you're afraid of being seen as uncollaborative, of not being nice. It's also resistance to giving feedback, not speaking up, checking out, you're there, you're not really there. And there's an interesting Gallup study of employer engagement at the workplace that says that around 66% of the workforce, they're just there, they're mentally checking out at work. So they're just kind of bodily there, but not really physically present. And then there is around 13% that are actively contributing, so that are in the green zone at the workplace. And then there's around the remaining, I don't know what that is, like 15% that are actively manipulating, so they're in the red zone. So the huge majority of people are in the pink zone. So this is a huge lost potential in collaborating and, you know, like getting our work done and working towards the SDGs, because if people don't really, you know, they're working but not really, they're not really getting anywhere. And, you know, to get out of that is really difficult, because it requires to be more, you know, aware of your own interests, and to also sometimes face confrontation and speaking up. So it takes courage to get out of here, and a lot of empathy also. And now we're doing a little game because collaboration doesn't really work without experience in collaboration. So I don't just want to talk about collaboration. So you will each have to get up, get a partner, go together and do the thumb game. The thumb game works as follows. So you tie your hands together like this. I can't really do it with myself that well. And you get 1 point by pinning down the thumb of the other person. And you do it like this. So, you know, Claire would get a point, like if you pin my thumb, and if I pin yours, I get one. So you start by my signal and stop when I say stop. There's no talking. You'll have around 20, 25 seconds. You need to keep count of your points.
Without lying.
Without lying.
No false backs.
So each of you needs to get a partner. Please get up. It's easier when you get up, because, you know, you need to move a little bit. So we are starting now. Please start. We've got 1 point for you. Okay, stop. Please stop. So who in here has more than 3 points? 1, 2. So my question, do you think you were successful in achieving your only objective, earning as many points as you could? Exactly. I never said you need to have more points than your partner. I never said you can't allow your partner to get points. You know, I told you to select a partner, not an opponent. So, you know, it's just how you entered the game, you know, your attitude. I need to protect myself. Of course, you know, it's how we know that game is, I defend my interest. I don't let the other win. So, you know, what's my definition of winning? And now, you know, we'll do the same game again, and, you know, try to earn as many points as you can in 25 seconds. And, you know, like really try hard this is your objective. Try to earn as many points as you can, and maybe applying a different strategy. So please get together again, same partner, and we start now. Yeah. Please start. Okay, please stop. Stop. You can sit down again. So stop, please sit down again. So show of hands, who has more than 3 points? So same question, and the huge majority, or like the number of people having more than 3 points, immensely increased. So, you know, of course it's oversimplified, it's just a simulation, but, you know, it's just to show you what difference it makes with which attitude I enter a collaborative or competitive setting. So, you know, am I allowing my partner also to achieving his or her objectives? Am I defending my sole interest? how much energy do I put into the collaborative setting? And if you just also, if in a team, one person has 50 or I don't know, 20, 30 points and the other has none, then the one with none, you're in the pink zone, you're not achieving your own objective. You're just letting the other win. So, how can you mutually support each other in achieving those objectives? So, just a little exercise to underline the importance of the attitude with which you enter a collaborative setting. So, now this is, we learned that green zone is effective, or in the long run more effective, and it's relatively easy to collaborate when when the sun is shining, when everything is nice. And then when the clouds come, the storm comes up, it's much more difficult. And, the problems arise, or, through we heard so much about anything partnerships. So, how can we train that? How can we practice being good in the green zone or creating a green zone environment? So Jim and Ron, they developed or came up with those 5 essential skills for creating trust-based collaborations and relationships. And I'm quickly going to run through those. The first one is collaborative intention. It's really how do I come into a negotiation, a collaboration, a partnership? Am I investing my energy into achieving my own and my partner's interests? And you can think of this when you fall in love. Now, I don't tell you to fall in love with your partners necessarily, but just what is your interest when you meet that person? It's really you want to have those interests met. You're investing all your energy, or a lot of your energy. At least I did when I fell in love. I wanted to please my partner. It was so important to have these common interests met. So just think of where am I investing my energy, and am I creating a setting of, hey, I want to collaborate with you. How are you creating trust? We tend to judge ourselves by our intentions. I want to collaborate, and others by their actions. And how can I show with my action that I want to collaborate? So the setting you create as a setup. Second one is truthfulness. Truthfulness means speaking my own truth and allowing others to speak their truth. Anyone knows that ship? Vasa in Stockholm. For those who are familiar or not familiar with the story, this was in the 17th century. It was the biggest warship built at that time by the King of Sweden. And it sank around 150 meters into the Bay of Stockholm. And it's now visible in the Vasa Museum in the center of Stockholm. And what happened is, the king wanted to have an extra level of cannons. And the engineers at that time knew, or they must have known, experts nowadays, they say they must have known that, it would sink because it was too heavy. And so, but no one felt safe enough to speak up against the king, because probably they would have been put into jail or assassinated, I don't know what. So, the atmosphere of speaking up wasn't there. It wasn't safe enough for people. And now, just for you to think, how much am I allowing my partner to speak the truth? How safe is it? Another example is the NASA. There was a NASA project, Apollo 13, I think. I'm not quite sure. I'm not that familiar with the different project, but it failed in the first iteration. And everyone knew that it was not working, but the pressure was so high, nobody dared to speak up. So, creating that environment, the truthful environment that allows to speak up the truth, and really also listening to others, about their interests. Are you truthful about your own interests and the interests of others? Next one is self-accountability, is being accountable to your action and also your inaction. So how much do you, it's again that the activity, the action you take in creating a trust and having the interests met. And, you know, how do you show up in a relationship? You know, do you check in with your partners? Do you ask them, how is it going? What are your interests? And also living with the consequences of your action or inaction. So not calling, not asking for the interests, or, you know, how they're doing, how is it going, is also an action. And, you know, just being accountable to that. And, you know, really asking yourself, how are you showing up in a relationship? Next one, self-awareness, is the iceberg. Again, is really like looking underneath the surface of what's there. How, you know, knowing yourself, your interests, your preferences. And I would like to quickly talk about the FIRO theory. This is a group development theory. FIRO stands for Fundamental Interpersonal Relationship Orientation. It was developed by Will Schutz. And Will Schutz was hired by the US Navy in the Vietnam War because they wanted to find out what makes team most performing. And up until then, their approach was, you know, we just put the most skilled people together, but it doesn't really work because of ego, power games, I don't know what. And, you know, Will found out that those three phases, inclusion, control, openness, they're key to having a team most performing. So the inclusion phase is people want to feel included. You know, it's about being in or out. So, you know, how, when being in a partnership, how do you include people? How easy is it for people to join, to be part of the group? You know, the one thing we do in Euphoria and Collaboratio is doing check-ins, just arriving in the beginning, you know, regardless of what the topic is going to be, everyone has the chance to speak up. So they're physically included in the setting. It also increases the chance that they're going to contribute highly when they have at least, you know, one word or one sentence that they can share with the group. The second one is the control, is being competent. It's about the roles. You know, what is my role? How can I contribute? How can I bring my skills to the table, to the project? Because if I can't contribute, I don't feel competent, why would I want to be in the group? The second one is the openness, is linked to truthfulness. Is it safe enough for people to speak up openly and be themselves? So it's being liked, make people liked. So, you know, it's really like the three needs is being included, being competent, being liked, being yourself. And again, you know, creating this environment that allows people to be that. Another one is PEMS, which is about preference in collaborating. So, you know, I assume there's as many different preferences to collaborating in here as there are people. And when you work with other people, it's very likely that they have different preferences in collaborating. So, you know, practical, some people just want to get things done. And, you know, when other people talk, they get nervous. They're like sitting on needles. You know, they want to work, like practically work together. Then others, they're more emotionally, they want to feel trust. They want to bond to others. They just want to chit chat. And, you know, then for them, the inclusion phase is very important. And then more mentally, people with a mental preference, not like mental disease, but it's more like the cognitive. They want to understand the theory, the logic behind, you know, they want to work with the numbers. And then the spiritual, they want to understand why, you know, this is happening, what's the purpose of it. So they really want to see the context. So it's, you know, it's not about right or wrong, it's about including all those different preferences. So how can we create an environment that includes and respects all those different dimensions? So, you know, sometimes having those check-in rounds, it can meet the emotional component, but also the spiritual, you know, understanding, okay, why are we doing this? But also, you know, the mental, you know, what is it about today? So just as a little reminder of, you know, when working with others, you're also working with people and preferences, and knowing yourself, your own preference, and the preferences of other people. The last one is negotiation and problem solving. It's interest-based negotiation, which was developed at the Harvard Business School. And I'm not going into detail, but just talk about the orange. So what IBN, interest-based negotiation, is saying is that instead of negotiating from position, is looking at the underlying interests. So there's a little story about two sisters that both want an orange. There's only one orange left in the house. So what do? They cut it in half. So both have 50% of their interests met because they have half the orange. However, this is a position. I want the orange. If they had looked at their underlying interests, is one wants the zest for baking a cake, the other one wants to choose. So, you know, they could have both 100% their interests met if they didn't negotiate from their positions, but from their interests. So, you know, really looking at the underlying interests. And this can be a game changer. You know, if you look at politics, how much, you know, this is my position. I'm not losing face and not giving in. There's so much more, there's so much energy invested into that than really looking at the underlying interests. So now, how much more time do I have?
A couple of minutes, but I'd leave some time for questions. So
sure.
We've got,
So a practical example about how this is implemented in idyllic Switzerland. So, you know, it's very easy to get the impression that in Switzerland, many things are perfect. But if you look at how the SDGs are implemented, actually not so great. So there's only 3 dimensions where Switzerland is fully complying. And if you look at SDG number 9, health, which is your topic, you know, there's still room for improvement. So Collaboratio it's a platform of change makers bringing people together, creating partnerships, collaboration around change makers. And what it is believing in the potential of individuals and organizations to collaborate and contribute naturally into achieving the SDGs. And it's also aiming at tackling the root causes. So, and how this is being done is through social innovation labs. So a method that incorporates that is, you know, bringing different people together, trying to understand the root causes, the system, so we don't work at the branch level, at the surface level, but really at the source level, and letting go of the old approaches. So the Einstein quote that I showed at the beginning, you know, trying to have some co-creation of prototyping the future. And, you know, Switzerland, for those who are familiar with the culture and the history, we have 4 different languages, quite some cultural differences. And if everyone just works in their isolation, you know, you mentioned retreating to your theory of change, your discipline. We're not really getting anywhere. So, you know, how can we create that everyone is working together on the source level? Because we all want to work towards the achievement of the SDGs. And, you know, the social lab provides one approach. And what a social lab is, or the elements of a social lab, is basically, it's social, so it has a team, a diverse team, multidisciplinary, multi-everything team, and those need to have the skin in the game. They need to understand the situation. It's not doing aboutism work, but really going in there. It's an experimental process. It's trial and error. It's long-term. And then also the space systemic, so it's not looking at the part of it, but really trying to have an inclusive approach. And then setting up the preconditions is, you know, what is actually the challenge? What is at the source of this iceberg that we're tackling? What are the resources that we have? Who needs to be in the team? And what is the strategic direction? I don't have the time to go in detail. And, you know, this is the work that we're trying to do. And actually, David is also coming to a training that we're offering in 2 weeks in Zurich around that. So, you know, how can we implement that through Theory U process? So, you know, that we can tackle those fundamental questions. This is the last slide, is what is the purpose of collaborating? You know, why are we really collaborating? Is it just a setup? Is it just because governments tell us to do or whatever? So, you know, what is at the core? And what are our shared interests? You know, really, like, don't talk about positions, don't talk about titles or whatever, institutions. What do we want to achieve as humans? And how can we put together our resources, our intelligence, our motivation, our hearts, heads, and minds to co-create the future that we want to live in and really work towards the achievement of the SDGs. So that's been a little introduction to my work. Thank you so much for having me, and we have some time for questions.
Yeah, please, I mean, we have about 10 minutes, a little less than 10 minutes left, so if you have any questions or responses, but thank you very much indeed. And what I particularly like is that it's the people-centeredness of the partnerships. Partnerships could be financial mechanisms, they can be the ways that sectors get together, but ultimately it's about the people working within them to make them work. So thank you very much. But do I have any questions or comments to either participants?
So probably, let's say I'm entering into partnership or collaboration. Give a set of recommendations, basically. I mean, not always has to go along and in the end say, oh, you know, this and that. And look at really this from the beginning. So, what would be a recommendation to go about this? Find out what's finding us statistics for successful collaboration.
So coming back to the green zone slide, it's, you know, like, what can you do to create the green zone? How can you create an environment of trust, long-term vision, so, you know, understanding why are you collaborating, understanding the interests, your contribution, not jumping straight into the solution. I've been part of and witnessed so many meetings where, you know, the tendency is there to jump straight into the solution. So what do we do? But not why do we collaborate? You know, who is sitting in the room? Who are you? What are you bringing to the table? What is bringing us here? So, you know, asking those questions, listening, and not just, you know, coming in with your agenda, but creating a common agenda. And this takes time, and it's much more successful. So it's an investment in the beginning. So you're investing in the people, in the relationship, and then, you know, solutions form automatically. Did this answer?
I have a more practical question from a more practical point of view. Many cooperation projects are run by small or medium-sized NGOs, national, international, and they often have quite some pressure by the donors to deliver measurable outcomes. That is very well because the donors want figures for the money, but often there's very little flexibility, and therefore, for me, it seems difficult to really cooperate with the beneficiaries, with the communities, as you recommend, and as it seems to make sense. How do you work with this dilemma?
It's to be honest, it's one of the biggest dilemmas in our work in Euphoria, because there are often conflicting conflicting positions. So it's, you know, really trying not to go into the positions, you know, you need to deliver that, and but what is the underlying interest? You know, going with the funding partner, okay, you want us to do our work. How can we do that together? So opening up the field and not going too strictly into, you know, you need to do A, B, C, but how can we have those interests met? And then, you know, bringing people together, you know, funders, and then the different partners, and creating that open dialogue. So, you know, the interests, they're all at the table, and everyone knows, because I believe that the funders and the partners, they want to work towards the same thing. So one example is liberals and NRA in the US. You know, they're fighting constantly, you know, gun control, yes or no, Bill of Rights. But if they looked at their interests, both want secure access to guns, both want want to limit access to guns by criminals, by mentally weak people. So, you know, going down there to the level of interest, that would be my, my response. It's not easy, it takes time. It's a long-term work in progress.
I think I'll add to that some experience also from the R4D program, which, as I said at the beginning, is a collaboration, an institutional collaboration between the SDC and the SMF, research and development. And of course, as I alluded to before, that's more than an institutional collaboration. It's a meeting and we hope complementarity of cultures of organisation, cultures of thinking about how we measure, exactly what you started with. And as I said at the beginning, actually that's quite a challenge because it's an interesting one where we all have to be adaptive because the ways in which most of us in academia have not been exposed to having to write policy briefs or communicating in certain ways, and many academics resist some of that to communicate their findings to a different audience. But part of the innovative collaboration that this R4D has set about to challenge us to do is to find those different ways of being measured and being seen. So not just the academic publications, but also other ways of communicating, pathways to change and so forth. But I think what happens is that you have to have both sides need to be listening to each other. And that's quite difficult. So the sort of the policy-oriented side need to think, well, you know, they're not used to working like that as well. We're trying to work with science. And the science people really understand, well, you know, you're being funded to do science for society. Science that brings change, positive and so forth. The SDGs. So I think it's really about respecting one another's different ways of measuring what it is to be successful. Two different cultures of what success looks like. Or more cultures, many cultures of what success looks like. Thank you.
I'm speaking later, so I have some points. One observation from the funding side. I think one of the problems with funders is that funders are very adverse figure. Yeah, so if you're putting money in, you can't pay. Yeah? So, and that is slightly different than in some of the private sector situations where they could actually calculate it in something. So I think that's one problem. One of the ways around it, just thinking, is need for openness between the funder and the fundee. So when things get difficult, there must be, when it comes back to a few of the things you said, there must be an environment in which the funding feels like it can go back to the funder and explain when things are not going the way it is. That's just something I wanted to mention. And the second thing I want to mention is that I do think this issue that you emphasize, which is understanding of the underlying interest of each partner or each negotiator is one of the most fundamental things. I think, it's when, as you said, you can't go in the room and find a solution. The first thing is to try and find exactly what the interest is. And that is a very good start to the question. My personal experience.
Thank you.
I noticed, yes, please. Thank you.
Yeah, I just wanted to ask one question. Madam, you talked about the holistic approach and talked about the different approaches of collaboration. And you said about the radical collaborations, the red and the green, and sometimes pink. So according to your experience, what is the difference, while working in the developed country, from converting the green zones into, converting the red zones into green zones. I mean to say from short-term relations or partnerships to the long-term partnerships on the basis of trust with the community and all different partners like the government, non-government actors. So how you see the difference, while working in the developed countries and the developed countries. We know that this COHESION project is being launched Asia, Africa, Latin America. So you share your experience.
So I don't have personal experience with working in so-called developing countries. With radical collaboration, I've mostly been working in Western Europe, Switzerland and neighboring countries. And what I encounter is, regardless of which culture, which country I'm in, it boils down to, those 5 skills. It's creating that environment of trust, understanding each other, even within one team, within an organization. I can be very different. So for me, it's easier to connect to people across the globe that are closer to me than, to my neighbor, who might be completely different. And then it's not about, stupid neighbor, but it's going there, understanding and investing into this. So it's, cultivating that attitude myself. So, I can do my work, and also I can work on a, let's say, policy level or structural level. What behavior am I inviting into? Am I creating an environment that's set up to collaborate? Like I protect my thumb and I'm competing with the other. Do I reward single performance, or do I reward collaborative work? Meeting mutual interests. So this is the level that you can work, and it's very much long term. It's not easy, but really creating the basis for this, right? So because you cannot change other people's attitude or behavior, you can only create the environment that allows them to step more easily into the green zone, regardless of the context.
Coming at the question from a slightly different angle, from the Cohesion Research Project perspective, we also have 3 very, very different countries and different continents, in fact. So one of the things we had to figure out in the initial stages, and there were some historical relationships, partnerships that had already been in place. So we were building on something that had already existed in Nepal, the long-term relationship, for example, with Geneva and the hospital. But we also have to respect the fact that we all came from and have very different ideas and very different disciplinary experiences and different expertise in our own countries. And that was a very important part of trying to figure out a methodology that enabled us to really leverage and take advantage of the fact that in Nepal we have a team who are superb at household surveys. In Peru we have a group of anthropologists who are super at doing community-based participatory work. And in Mozambique we have a team who are specialists in hypertension and around some rural areas. And I think the partnerships but sometimes there are limits to collaborations and partnerships, and we have to actually be mindful of them and think about them and work with them, rather than see them as barriers to anything that's going to happen. But I think a lot of that is really about working very much with the expertise and making sure you pull the strengths that each of the parts of a collaboration or partnership have, rather than focusing on the weaknesses.
Yeah, that's building up on the FIRO theory, including them, making sure that they can contribute with their experience, and then creating the environment where they can speak up and co-create new solutions, can be co-created and implemented.
Okay, I'm mindful of time, and I've already overrun. I'm sorry about that. I shall keep better time in the next session. I'd like to thank you very much for joining us and contributing. I hope you can stay for a bit longer this morning. We have a short coffee break now. We will be back here at 11 o'clock for a panel discussion with five panelists for the next year. So thank you very much, everyone. National Health Corporation. He's also a member of the board of Medicus Mundi and the Swiss Civil Society platform Agenda 2030. He also is a historian by training and has been working for the last 20 years at least in NGOs. So a wealth of experience to share with us. Thank you, Martin. Can I hand you the... I'm sure you can be heard.
Thank you very much for this warm welcome, dear colleagues. Good morning. Very appreciated this invitation to this conference, and I'm sorry if I'm going to spoil a little bit the party of partnerships now. What I'm going to tell you now, I have written it down this morning in the train, so when I had to get up very early, so not a lot of coffee in the brain, no sugar at all, so please, I'm sorry about this. I feel a little bit intimidated on this panel. There is Erika Placella. She's representing our main donor, the Swiss Agency of Development Cooperation, and Luciano Ruggia is from the Institute of Social and Preventive Medicine, and these are member organizations, and he is actually in the board of Medicus Mundi Switzerland, so he's my boss. But anyhow, so to make this already clear, the background, I try to be as open as possible. Partnership seems to be a big topic in international politics in general, as well, especially as well in global health. It is celebrated at the moment everywhere and has achieved the status of a magic wand. It is one of the cornerstones of the SDGs, of SDG 17, where it is asked to foster global partnerships and multi-stakeholder collaboration for mobilizing an exchange of knowledge, expertise, technologies, and financial resources. To be clear, as the director of the network Medicus Mundi Switzerland, of about 50 Swiss organizations working in the field of international health cooperation and global health, partnerships are very important for us. We are doing this since years now, that we are fostering partnerships between quite different member organizations, and this is the foundation really of our work. We know how important partnerships are for collecting knowledge and experiences, to validate these experiences, and to use these evidence we gain by this for strengthening the quality of Swiss health cooperation and to advocate for our common goal, health for all. But starting from this background, we know as well how much hard work it is to collaborate in partnerships. There are always conflicting interests, and we already heard this morning how important this interest landscape is. There are always institutional constraints and different values in the game that cannot easily just conjured away by praising partnerships or multi-stakeholderism. So I will give you just some examples to take out some out of each example. I try to take out the conclusion. So as I told you, or Claire has told you, Medicus Mundi Switzerland is member of the civil society platform for the Agenda 2030 here in Switzerland, and I'm the member of the board. This is quite a broad union of different CSOs, actors coming from international cooperation like we do, Swiss ecological organizations, human rights associations here in Switzerland, actors in the field of social protections, and trade unions. Recently, we have developed a fact sheet on climate change and SDGs. Easy thing, you would assume, but you are wrong. The first draft was vetoed by trade unions. So this is the first conclusion for me. And partnerships have to invest time in debating conflict of interest, and we had already this interest issue on the table, to make them transparent, and they have find ways. Partnerships have to find ways, and each partner have to find ways and instruments to bring different actors together. You cannot wash them away with nice wording. Second example, going closer now to health. The next example I take out of a process of reflection we have had within our network, and this flew partly into our manifesto, Health for All Within a Generation. You find it as well outside and English on our website. So as a result of the SDG framework, one thing for us, and us I mean our member organizations, mainly NGOs working in the field field of international health cooperation. The work of northern NGOs has to change. We state in the manifesto, and here I cite, the consistent implementation of Agenda 2030 will lead to a continuing evolution in the role of Swiss organizations involved in international cooperation. The number of projects and programs we implement ourselves will continuously decrease. Local partners will increasingly take on this task. Our role, Northern NGOs, will become more and more that of a facilitator, imparting knowledge and procuring still lacking resources. Collaboration and partnerships will become ever more important. The times, and this is behind this as well, behind this reflection process, the times are definitively over that northern, mainly white men, bring help to underdeveloped global south. It is the end of the aid paradigm, luckily. But the economic system of most NGOs still bases on the aid paradigm. So a conclusion for me and for us is, for truly new partnerships, we as individual organizations and institutions have to be ready for change. Therefore, we have to learn and set our organizations on new foundation. Not all organizations and institutions are ready or fit enough for that. My third example, now we go on the global level. Recently, the 12 main multilateral agencies in global health have adopted the Global Action Plan for Healthy Lives and Well-being for All. WHO was an important player in this development of this Global Action Plan. Among them is WHO, Global Fund to Fight AIDS, Tuberculosis, Malaria, Gavi, UNAIDS, and others. The objective of the Global Action Plan is to enhance collaboration among the 12 agencies to accelerate country progress on the health-related SDG targets. To accelerate country progress, this partnership would be really very important. One tool could be that the different development actors put their financial resources together in one country basket that would allow the governments to invest the resources according to a countrywide health plan. I was these days at the Global Fund board meeting here in Geneva, and we have talked as well with African governmental representatives. In most of the cases, it is still not possible to pool global funds in such baskets because the Global Fund regulations are not allowing that, and Global Fund is very proud on its regulations and system. Conclusion: for making partnerships really effective, global health initiatives have to become more flexible, ready to carrying rather financial risks instead of programmatic risks. And the last, and it is related to what I said just before the example, the next example, another reflection that comes from the last days, comes as well from the last days at the Global Fund. The Global Fund has, with the so-called country coordinating mechanisms, a very good instrument to bring governmental representatives together with other stakeholders like CSOs, communities, and key populations that are affected by these three diseases: AIDS, tuberculosis, and malaria. Again, for achieving the SDG goals, it is necessary to leave behind a little bit these disease-centered instruments that are coming out of the MDGs area. They are from another time. And by the way, many of these organizations and global health institutions come out of this other time. But are governments ready to open up such forums for further partners? And are, for example, HIV NGOs ready to sharing power within such forums with other disease-specific organizations, like, for example, an anti-diabetes action group? This is my last conclusion. Partnerships is about power sharing, and power sharing threatens the power of an organization in the institution who has already the power. So these are some reflections. I would like to end here. I think there could be other topics here on the table. Maybe it will be addressed anyhow. Sometimes we feel as NGO organizations, and I think at the moment many Swiss NGOs felt quite strongly pressed to go into such partnerships from outside and as well to work together, multi-stakeholder consortium. But it's not so easy done as we often think. Thank you.
Should I just introduce? Sorry. Thank you very much. Sorry. Thank you very much. And I think that's a nice reality check on partnerships. And I think I would also add that as well as power inversions that are required for partnerships, there's also some disruption to what we consider to be knowledge and knowledge paradigms. So moving now on to Luciano Ruggia, who's the head of research and director of the ESTHER project at the Institute of Social and Preventative Medicine in Bern, University of Bern. I'm sure you'll explain more, but ESTHER is a program that to foster institutional health partnerships between Swiss and low middle income hospitals, applying the most advanced concepts of global health cooperation. So I hope to hear some more about that. He's also director of the Swiss Association for Smoking Prevention and previously worked on HIV/AIDS for the Swiss Federation.
Thank you, Claire, and thank you, Martin, for what you say. You covered quite a lot already. Yes, I'm the manager of a project called ESTHER, which is a project fostering institutional health partnership between Swiss and low and middle income hospitals. And we support projects within partnerships. So I think it is very important to think that a project, and very often the logic of international cooperation and also the donors, are supporting projects with a nice log frame, with objective, smart objective, please, that you can quantify, you can measure, and at the end you write a lot of reports, nice reports about the project and what you achieved, but not about the partnership. You're not talking about the partnership. The partnership is a long-term commitment. The partnership is like a marriage. And the project is like having a kid, having a baby, raising the baby until he's 18 years old and he can have his own life. But the baby is not the marriage, is not the partnership. And the partnership, like in a marriage, you're not equal. We are not equal in North-South partnership. It's just a fiction pretending to be equal, because very often from the North we come in with money, with a certain framework of vision of what we want to do in global health. We say, oh, we want to tackle AIDS, we want HIV and AIDS there, or infectious diseases. But have we been really listening to what they need there? Because, of course, AIDS can be a huge problem in a country, but maybe it's not what they want as a first intervention there. So I've seen a lot of projects where, because the hospital or the doctor in the North is a specialist in something, he wants to do something because he's a specialist in that, but it's not necessarily what in the South they really need. In a marriage, you should learn to listen. Partners in a marriage are not equal. Very often the woman is not earning as much money as the man still today. It's true. You don't have the same social status. You don't distribute home tasks equally very often. But it doesn't mean that you should not consider yourself and a new partner as equal in the marriage. You should share this decision. You should listen to the other. You should really share the partnership. But it doesn't make you totally equal. And recognizing this, I think, also in global health partnership, that the partners are not equal because they don't have the same means. They don't have the same vision. But you should listen, you should build a dialogue. This is very important. This is a constant working, because my topic was redefining North-South partnership in 7 minutes, which is quite difficult. But I think it's a constant, never-ending work to work on a partnership. Like in a marriage, it's never over. It's until the end you have to continue to discuss dialogue. And with SDGs, I think it's very important. We have the list of the SDGs. Everybody knows the SDGs. And 16 of the SDGs are about what? 3 is about health, 4 is about education, 5 is about gender equality, and the 17 is about how? Partnership. So, yeah, we're talking about how we should improve this kind of working together in order to achieve all the 16th. Thank you.
Thank you very much indeed, and a really nice metaphor of the project as a kid and the marriage as a partnership. I think it's long-term, short-term perspective. Thank you very much indeed. So we're now going to move on to Guy Fones from the who is advisor at WHO's newly launched department, the Global NCD platform, which also houses the Secretariat for the Global Coordination Mechanism for Non-Communicable Diseases, so highly relevant to our COHESION project. He has more than 25 years experience and achievements in public, private and global health, and was previously health attaché for the permanent mission of Chile in Geneva. So a vast experience in different dimensions of global health. I invite you to make a presentation. You can use that one, yeah.
It'll go on. And hello, thanks for the introduction. I do have slides, so...
They should be in there if you, just with the arrows. Yes, if you keep going.
Or this way.
Sorry.
There we
These
go.
ones?
Yep, thanks. Well, thanks so much, and it's been a really great morning so far, listening to a lot of interesting perspectives. My role isn't necessarily easy either. This is a 7-minute presentation where I'll try to land on WHO, partnerships, and NCDs. The order of those words is not quite accidental. I think this is extremely relevant from a WHO's perspective. The ordering and the priority there in that title given to partnerships. I hope to land on a few highlights of why this is, and hopefully I can unpackage this sometimes very complex space for WHO when developing, thinking, designing partnerships in public health. The first hint at why that order is so important is this title here, the Pro-Health Partnerships for the Prevention and Control of NCDs. This sort of draws the clear focus on WHO's priority and the priority we put on partnerships that we develop and design and even co-implement in many cases. Let me try to move this here because I'm not here. Let's look at the challenge here for WHO. This is a very blunt and frank comment and phrase, but it is very, very true. We are dying too soon of illnesses that we know how to prevent and for which no government alone will have the sufficient resources to effectively manage. This is the NCD challenge, and this is probably also, you can extrapolate to the health challenge, the public health challenge broader, but for the NCD is extremely relevant. We have recurring criticism and comments of how we define our space. We define our space in the NCD world as what we are not, non-communicable diseases. This certainly draws some issues on how we can address some of the underlying elements of the NCD agenda. But it also draws, I can also draw attention, and it's very interesting to note that what it is not is shrinking. What NCDs is not is rapidly shrinking, and what it is, and the expansion into where NCDs really has its tentacles is growing at increasingly space. We are certainly connecting throughout all the SDGs, probably if we look into a bit more depth. We are certainly impacting and having influence on different SDGs. We are certainly moving from beyond the health sector to other sectors of health, which are extremely relevant if we want to unblock the last frontiers of the NCD agenda. And we are certainly pushed to then move into the societal elements of the NCD agenda, the different stakeholders within society. So really the NCD agenda is very complex, interconnected, and challenging space. But we have a strategic direction now. We have, WHO has its norms and standards, it has its frameworks, its policy opportunities, its policy options. But we have a new strategic direction which WHO and its member states have outlined, which is pro-health partnerships. And as I put here in the slide, so the urgency for public health partnerships is that we collaborate, innovate, and affect policy for improved public health efforts. This is our role in the public health partnerships, in the pro-health partnerships. In one of our latest high-level commissions on NCDs, we were discussing on PPPs, public-private partnerships. And one of our commissioners, high-level commissioners, branded, this is a very complex area, and if we really want to understand PPPs, it really is partnerships for the public good. And so WHO is trying to unpackage this and try to understand what are the different elements that come into this, the broader implementation of pro-health partnerships. So just a few important points there. The second bullet here is very interesting. The public health has a responsibility and the moral responsibility to harmonize available strengths from different sectors and stakeholders to align, complement, inform, and empower our common goal and our common interest, as we heard this morning. I think that's an interesting entry point for how we can, that WHO understand our ongoing and future collaborations, is to really start from the starting point of the common interests. And then it is, as I said, for the NCD agenda, which is so complex, partnerships is really about letting go of silos, breaking down silos, and finding that common ground, the common interest from a public health perspective, and investing in what I say there is a social accountability through clear investments in local communities and local priorities and local challenges. So one of the challenges in identifying from the WHO's perspective, identifying partnerships, is to really understand how we translate those global policies, global commitments, global frameworks into community impact, into local impact through the support of our many partners. All right.
Is it not changing?
No.
Is it changing on the computer?
Oh, wait a bit. I'll speed up the last slide so we can meet the 7 minutes.
It's okay too.
Here we go.
Oops, sorry. That's the one.
Yeah. So I was just landing on that slide we were on sort of what is our challenge and what is our strategic direction for WHO, and then how we're doing this, how we are combining, how we're implementing that strategic initiatives is through many initiatives through WHO. But one of the clear opportunities for that is the recently launched department in WHO, which I am very pleased to be part of, which is WHO's global NCD platforms, which combines and leverages different multi-stakeholder and partnership models and platforms that did exist. We have combined them, leveraged them, and providing additional entry points and connections and intersections. One of the platforms that this new department does leverage is the global coordination mechanism, which has existed for the past 4 or 5 years, and the GCM, what we call the GCM, was launched in 2015 as WHO's first engagement and partnership model and platform for NCDs. So we have a certain amount of experience in this, but we are now into a new mode of engagement, interaction, and a balanced approach with other platforms across the UHC agenda, which you mentioned very well, which is now the umbrella for many of our integrated work in WHO. So the purpose of this new department, which I want to highlight because of the opportunity to implement the collaborative approaches and partnerships, is to coordinate and mobilize meaningful and effective commitments from across these stakeholders in support, obviously, of WHO strategic directions. WHO strategic directions are a member states' strategic directions, so it really is supporting our member states at the end. Now, in that purpose, I think WHO has strong emphasis on a few of those elements. One is to mobilize meaningful and effective commitments and contributions. While there are shared interests, while there are shared value propositions in any partnership, WHO has a very strong attention and care into effective, meaningful commitments and contributions that align to targets, goals, priorities, and challenges, not only the global, but certainly at the national. So that is of particular importance, and this is where the pro-health partnerships take full scope, and how we start shaping and co-creating these partnerships with these common commitments and contributions. And at the end of the day, what WHO is looking for in partnerships is to really promote the policy coherence across these many layers, sort of a matrix, sort of vertical and horizontal layers that bring together the NCD agenda across all these different elements that I mentioned before. And the GCM in particular has a very innovative partnership model, which we are currently revamping and enhancing, and it will be the platform for many of these collaborations. Oops, we have the same problem again. Sorry. How much time? Maybe a bit over.
Okay, another minute.
Okay, very quickly then.
I don't know why it's frozen, I'm sorry.
There we go. I'll really skip through some of these slides. This was just showing where these opportunities for partnerships are drawn from some of our political intergovernmental declarations and commitments, from a few WHO working groups that have dived deep into the different elements of establishing partnerships. And recently, we've had a high-level commission that has had some very particular action on. It doesn't matter, it doesn't change, but we'll move. My last comments were really on two innovative approaches which my department and the GCM has been launching and will be supporting, which I think implements some of these elements and through our partners. One is we are taking the model of the global coordination mechanism, in a sense of how we have been able to coordinate partners and stakeholders and knowledge and co-creating knowledge at the global level, and we're taking it into supporting our member states implement national coordination mechanisms. So it is really understanding how to unpackage this at the national context level. So it's very different when you speak about the global policy discussions and enabling elements at the global level, and when you take them to national level and try to implement them through structures and collaborative structures. So we are developing frameworks and guidance on how to establish, again, national coordination mechanisms for NCDs that will build on other coordination mechanisms at the country level. It was interesting to hear the global funds national coordination mechanisms. We want to leverage those and others that are on the SDG, air pollution, climate change, that are working at national level. And then the last of them is one of the main elements that we are enhancing and taking into different phases, is the co-creation of knowledge for NCD. And I think that's an interesting area for partnerships and collaborations. Certainly this is around projects and implementation at national level, but it's also how we co-create knowledge and resources and tools. And we do that at our department through what we call the Knowledge Action Portal. Recently launched Knowledge Portal, very comprehensive knowledge portal. I will invite you to visit. I can share the slides and we have a link to that there. So I think that's just landing on the last opportunity, which is the co-creation, co-design, and co-management of knowledge, which is extremely important.
Thank you very much. And it's interesting to hear how WHO is progressing from, and I'm glad you responded to the sort of global to the national cascade of these things, because of course that's quite a different matter to move between them. But so thank you for telling us more about that. I'd like now I'll pass you the microphone, to hand over to Greg Perry, who's Assistant Director General, ADG, of the International Federation Pharmaceutical Manufacturers Association. So that's the IFPMA, where his responsibilities for external outreach and stakeholder engagement. Prior to this, he was Executive Director of the Medicines Patent Pool. He's been on the board and advisory committees and so on a whole list of organisations that from the Organisation for Professionals in Regulatory Affairs to the Standing Advisory Committee of the European Patent Office. So I guess you'll have a great first-hand experience of what partnerships are, I imagine. So I'll hand over to you to make a presentation. Thank you.
Okay. Thanks. Yeah, thank you very much for that introduction. In fact, I'm going to start with a quote. We had a quote from Einstein before. Here's a quote from Darwin. It is in the long history of humankind that those who have learned to collaborate and improvise most effectively have prevailed. So it's collaboration and improvisation in humankind that has ensured the continuation of the species and not, as often misquoted, the survival of the fittest. And I think it's quite an appropriate statement to open up because collaboration is indeed partnership. So what I want to emphasize today, I'm going to go a little bit into my own experience of partnerships as well, which I've done through the Medicines Patent Pool and previously as I run the European Generic Medicines Industry Association as well. But let me just start off very quickly with this industry, the innovative pharmaceutical industry. And we represent over 30 R&D companies and 50 national associations throughout the globe. It's based on a number of principles. One is a strong competitive R&D model. The second is intellectual property in order to raise financing from the private sector and also to share knowledge. Strong science and medical progress, strong regulatory environment, and increasingly partnerships. And the partnerships have formed an increasing part over the last decade and a bit more, how this industry is operating. And it operates in two principal areas. One is in the area of innovation, which I'll come to, and the other is in the area of access. And the reason why this is happening is because both the development of new innovations in medical science are highly complex and highly risky. And secondly, in dealing with access, it's very complex in order to obtain and ensure access because there are so many parts of the access road that has to be fulfilled in order to get there. So that's why the industry is focusing in these areas of increasingly in partnership. And I would say that the partnership drive has helped accelerate recently with the concept of the SDG 17, and also with an increasingly understanding that there is a positive role for the private sector in the area of global health. And we see that here in Geneva, from the wish to engage in the private sector more in partnership. We also see it on the ground and in Africa, and particularly where we have a special engagement policy. African countries have moved from a sort of a more, own, control and direct an economy more towards enabling guidelines and regulating the private sector in order to achieve economic and social objectives. So I think the opportunities for partnerships will increase from the private sector and from this industry as well. Now, I actually did a presentation on Monday at the WTO also on partnerships. And I outlined there what I thought were 4 basic principles of ensuring partnerships and how you get into partnership. And I was glad to hear that some of these were mentioned this morning. So I mentioned, this comes from my own experience, is one that you do have to have clear common objectives. The second is you need to have some form of common ethical or governance framework and an understanding of why you're going into collaboration. The third, and it's very important, is the idea of trust and mutual respect. Without that, basically, it can't move forward. And the fourth, and it's what I emphasized this morning, was the understanding of the underlying interest. And I thought that presentation with the orange, which I had not seen before, was absolutely superb. Yeah, and I think we can take that not just as trying to deal with partnerships, but how to deal with our own children. Remember what the underlying interest is when they're complaining. Yeah. So, and just very briefly on 2 personal past experience. I headed the Industry Association for Generic Medicines in Europe, and I'm not talking about a formal partnership here, but an informal partnership was what existed between the industry and the regulators, because as an industry, we engaged in dialogue around future legislation, around future guidelines. And to be able to do that, we had to, we understood what our common interest was in Europe. It was to achieve an efficient regulatory system with the purpose of serving patients at the end. We understood and we trusted one another, and we knew where our red lines were. And we knew that we had underlying interests that we openly talked about. And it was a very interesting development in Europe, and how there was a complete change in pharmaceutical legislation, and particularly in the regulatory side. And a lot of that was helped by a sense of common understanding and partnership between an industry and a private sector on the other hand, and government and regulators on the other. The second in my own experience was also with the medicines patent pool. And I had the pleasure actually with working with a guy who was actually our funder at the time. So, and I'd be very interested to hear what do donors look for in partnerships, and see if we got it right in the MPP. But one of the key things did in the MPP was indeed these two things, was looking at developing trust between the organization and particularly the pharmaceutical industry, because we were asking to share intellectual property, which is a key part of the pharmaceutical industry's baseline, as I mentioned. And the second was looking at those underlying interests, going to a room and saying, what is it you really want? Yeah, and how could we achieve it? And what was our common objective? Was access. Was access to highlight access to get products to patients. And the industry wanted to do that, as well as the donor and the organization. So I think these common themes are absolutely fundamental, and partnerships are not easy. People talk about partnerships a lot, but they do require a lot of pre-understanding and a lot of effort, as been mentioned today. I just then quickly want to outline some of the partnerships that have been developed with the pharmaceutical industry. I have a list that's up there. There are actually over 200 collaborations that individual companies have initiated from this industry. They cover over 850 partners. Many of those are in Africa. They cover a whole range of treatment areas. Many of those are related to access, some are related to innovation. I do invite you to actually visit the link in the website that is there. But very, very quickly, I just want to underline a couple of other things. On Monday again, it was the 20th anniversary of the MMV. This is a great PDP, the Medicines for Malaria venture. And this is a fantastic example of a partnership between the private sector, the industry, there's 4 or 5 innovative companies involved, academia, and the PDP itself. And when this was launched in 1999, before the Global Fund, before PEPFAR, almost like a barren area of PDPs in Geneva, there was virtually no pipeline in malaria products. We had a couple of malaria products which were only used for adults, and principally sort of generated more for, let's say, tourists rather than the indigenous populations of where a lot of the problems were. Within 20 years, 12 new products came to the market, 30 products in the pipeline, several fundamentally important new child formulations were developed, and that happened because of a partnership between those various groups. We have a partnership that we run or is hosted within the IFPMA. It's called Access Accelerated. I know it's known to a number of you in the room. It focuses on NCDs. It focuses on building the various parts of the road that can lead to ensuring treatment. So it focuses on health system strengthening and supply chain. And I just wanted to emphasize one point, which I think is important, as mentioned by the first speaker, and the importance of local ownership, because one of the principles of Access Accelerated is to reduce program fragmentation in focus countries. And that is focusing the strategy into the commitment with local ownership and long-term sustainability and aligning with national defined NCD priorities. And key in there has been the involvement of people living with NCDs. So that's a fundamental part of the Access Accelerated philosophy. There are other areas that IFPMA has been involved in. There's WIPO research is one, patent formed is another. But I want to end on one point, and that is where I think many of us have been involved, and that's in HIV. And as I said, I had the privilege to work as 5 years as the ED of the Medicines Patent Pool, working with Unitaid, which is an amazing organization that's investing in critical areas of HIV and other areas. But the HIV wasn't a formal, it's not a formal partnership what happened. It is a partnership. It consisted of commitment from governments actually pushed by communities. So the communities, the people living with HIV, were the drivers of so much within that. You had unprecedented innovation that came from the industry in HIV. A death sentence, which is now essentially where the products are available as an unmanageable disease. You had financing through the Global Fund and through PEPFAR. You had health systems strengthening, financed as well. You had procurement, you had access programs, and in a sense, the success, and it hasn't finalized yet, there's still more to be done, happened because of a concept of partnership and all various stakeholders, civil society, R&D industry, generic industry, funders, government, all working together with a common objective and making a change which has made a fundamental change to so many people in the world. And that's why partnerships are so important.
Thank you very, very much indeed. And I'm really glad to hear you also mention the importance of civil society in all this, particularly in terms of our COHESION project. We did a policy analysis on NCDs. And in fact, one of the things that we felt had been missing but then became a trigger was the emergence of a civil society stakeholder group whose voice became more and more important. So great, thank you very much. I now have the pleasure of inviting Erika Placella, who is the Deputy Head of the Global Health Programme at the SDC, the Swiss Agency for Development and Cooperation. She leads the development of global initiatives aimed at contributing to major health challenges, including health governance issues. In particular, she has developed a new programme aimed at fostering dialogue and collaboration on health along the new Silk Roads, fascinating, as well as reflecting on innovative partnerships to improve the access to NCD products and technologies, so very much aligning to our previous speakers. Before this, she worked for various different medical and public health organisations across Asia, Africa and Middle East, and worked on many issues, including NCDs, child health and sexual reproductive health. So thank you very much for joining us this morning, and I look forward to your
Thank you. Good morning, everyone. So, let's see how, and thanks for the invitation to be on this panel to share some thoughts with you about how we engage in polygamy, marriages with many children, as you know, Luciano. So, first of all, I would like to make some preliminary observation on SDC overall approach to partnerships in health in general. So, we committed, Switzerland and SDC committed to the SDG 17, aiming at strengthening, as Luciano mentioned, strengthening global partnerships to support and achieve the 2030 agenda targets. So, meaning that we have committed to that overarching framework. That's the global framework. Then we use, as most of you know, we use various instruments to work on health, to support health system strengthening, ranging from global programs to bilateral programs, research programs, etc. Because we do have a lot of instruments, the organization is engaging in many partnerships in various forms and formats, ranging from mandates at bilateral level through tenders, to contribution to UN organizations, trust funds, basket funds, platforms, and alliances. The partners we are engaging with are so very diverse, ranging from governments, international agencies, academics, private sector, civil society, and citizen, especially when it comes to creating enabling environments and civic engagement for addressing NCDs risk factors, for example. Now, although we have established guidelines and procedures to working with different partners, we remain very flexible in engaging with new stakeholders, and this is really to leave sufficient room for opportunities and innovation. So, in other words, we do not have a kind of standardized approach to partnerships, including with the private sector. So now that was the first part on very general on partnerships. Now, thinking about partnerships for NCDs or pro-health or partnerships for health, there are key considerations to be considered before engaging in strong partnerships. And the first one has already been mentioned, but it's really about, we think that effective partnerships should firstly aim at advancing policies and norms at the global level and at developing and implementing national action plans on NCDs, for example, to give, and more especially, for example, on access to NCDs, drugs and technology. So first of all, address at the country level and global level norms, policies, and regulations. Then fostering political, we are not an NGO, so fostering political commitment and ownership of national action plans, for example, on NCDs, implementation process is also key for us. So partnerships with governments. And of course, strong partnerships should aim also at finding champions to drive action, being it at the national level, at the global level, regional level. And still, as regards access to NCDs products and technologies more specifically, partnerships should also aim at strengthening good governance. This has been also mentioned by all panelists, strong and concrete accountability mechanisms. This is very important for a donor, that we do have a kind of very clear accountability mechanism, including social accountability, and then of course greater transparency. And then SDC promote joint investment of developing agencies and the private sector as an instrument of development cooperation, the so-called PPPs. We basically promote two categories of PPPs. The first one is about product development, such as developing vaccines, for example, and the access, of course. Now, governance arrangement and power distribution is key for us in PPPs. So especially as regards North-South partnerships. And SDC sees the clear division of labor between partners engaged in PPPs as key, as well as shared responsibility, you also mentioned this guy, and shared risks also, and sharing the risks of equal dimension. And then, of course, mutual accountability in this regard should also be ensured. Now, there are, in addition to that, there are other very important elements when engaging in partnership for health in general. And we think that effective partnership should also aim at advocating for adequate domestic and external financial resources. This is key for a donor. I mean, to implement, for example, the NCDs action plan, especially in low resource settings. So the goals, the aim, I mean, the objective of the partnership should also address sustainability, financial sustainability issues. And then beyond the mobilization of financial resources, partnership should also aim at building national capacity to address, still talking about NCDs, to address access to NCDs, medicines and technologies, and then society-wide participation. This was also mentioned by you, and uptake, society-wide participation and uptake is also critical. And we think that government will need to engage all stakeholders, including professional groups, civil society, and consumers, to fulfill the ambitions of the NCDs plan. But this can be transferred to for example, the AMR agenda and to other kind of partnership, pro-health, or to fight against any kind of disease. Well, that's it. So accountability, shared responsibility, transparency, social accountability, common goal. I think this is nothing new, but we just have to implement it and to support those who are implementing and having that vision.
Sorry. Do we have another one of these? Great. Okay.
Now work. Does it work?
Yeah, so we can use that for the audience, and I'll use this one for the panel. Okay, thank you very, very much, Erica. It's really, I mean, you outlined some of the key values I think that are shared amongst you at the table, and it sort of struck me how you weave together actually a partnership at this table in a sense. So thank you very much for your contribution. I'd really like to open it now to the floor to have a more of a dialogue and discussion, be a bit more interactive. So are there any comments or questions to get us going from the floor as before? I don't know if I should stand up. Please, thank you. Would you like to say who you are, where you identify yourself so that we have the context? There's a microphone just coming, so it's a bit easier. Thank you. Yes.
Thank you, madam. I'm Kumar, counselor from the Permanent Mission of Nepal. My question is directed to Madam Erica. This is about the partnership, maybe partnership between the donors and the receiver. We know that, for partnership, institutions, researchers, different actors are required there. And you also talked about the good governance. Let us assume the situations of such countries which doesn't have the governance, let go good governance. That is suffering from resources constraint, no capacity building, no transparency, no accountability, but people are suffering from the health problems like chronic diseases, this tropical diseases. In such scenario where you cannot find the equal partners to advance the partnerships in the health sector. So what approach is likely to be adopted to help those people living in such countries, in such scenarios? Thank you.
Thank you. Thank you, Erica. Would you like to respond? And actually, any of you who...
I'm not sure I understand the question, but I'll try to address the governance issue. So I think that we are not, SDC, I mean, beyond health, is not going to engage in a country where you don't have the basic governance requirement being met. So first of all, it's not about, it's really about commitment and the capacity of governments to engage in a kind of dialogue on governance, and that's beyond health. I mean, because we do have, when we have health portfolio, we do have we work on other themes, or including governance, or themes, or cross-cutting issues, so we do have a dialogue at the highest level. And if those conditions are not met, then we are not going to engage. So that's the first, let's say, the first, gatekeeper, and the first step is to assess whether it makes sense, whether we do have the minor requirements which are met to engage in international cooperation and collaboration with that country. And then, of course, on health, we try to, then there is the Ministry of Health and other ministries engaged. For example, when it comes to NCDs, you will have to discuss with the Ministry of Education, Ministry of Transport, Ministry of Economic Affairs, etc. And then again, we have to assess what kind of basic requirements in terms of governance setup or in terms of processes are met in order to engage. But it's very difficult, and sometimes we do have a kind we take risks because we think that a lot can happen, can be learned throughout the partnership process. But we have failed many times.
Guy, please.
If I may,
excuse me, madam. I just wanted to clarify my points. That how, we can make partnerships in capacity buildings or in the, building the, good governance, especially in the area of health.
Okay. On capacity building, we are not an NGO, so we are not implementing our projects directly. We work through local organizations, including when it comes to, for example, capacity development in health, medical education. So we do work with local stakeholders. So we don't engage with international. Okay, we engage with international partners to coordinate the implementation, but then most of our programs are implemented by local actors. So it's very much bottom up. So that's also one of the we didn't discuss about this, but for me it's still part of governance that it has to be bottom up. So the demand has to be expressed by the countries in the south, in this case, and then we will have to match. We see ourselves as really the ones who can match the demand with partners in the north and in Switzerland, and that's what ESTHER is about, actually.
I just have to add a few some highlights on your attention to governance. I think this is an extremely important discussion. And for WHO and its member states, this is becoming of critical importance now. And I mentioned a bit of it in my intervention, but I think the governance around NCDs in particular, and this can very easily be extrapolated to across the health agendas. But for NCDs, the governance structure, the governance mechanisms, platforms, and frameworks at national level are extremely important. We touched on it and I think you touched on it briefly, but we didn't touch on it more than that, very briefly. The inherent conflict of interest that do exist in the NCD agenda. And we have had years of discussion around management of conflict of interest when addressing NCDs and addressing different stakeholders and sectors. And now we're discussing moving the next step forward and how do then we look for common interests. So in that very complex roadmap of first identifying the inherent and always present conflicts of interest that can happen even between public sectors. Different sectors of government have of conflict of interest, and then we go open up to stakeholders and private sectors. So first of all, to manage the conflict of interest. Once we have a safe space where we manage them, then we've got to find the common interest to then establish. So all of that structure and addressing sectors within government and stakeholders without government is extremely relevant and probably the bottleneck for implementing national NCD responses. So our priority now is to support not only WHO's priority, I say WHO as a HQ structure of norms and standard setting, but our member states. Just an example that we have just recently finished an exercise where we are collecting our country support plans, where our countries, each of our member states drafts its requirements, its requests from WHO to implement or address some of its gaps. And probably more than 60 countries have forwarded a request for WHO to support them in establishing coordination mechanisms for NCD at national level. So this is becoming extremely, not only our intention to provide that support, but the priority from countries requesting immediate response and immediate support from WHO on that. So the governance issue is really important.
Martin, you want to take that?
Yes. Very short, but thank you very much for this question and addressing this point. Sometimes you have partners or potential partners that just are not able to really fulfill their duties, mainly to fulfill the right to health for their people. And at the end, I think partnerships are not just a goal on itself. It's really to put the people in the center, and this is that really the people have access to health services and get the health system work for them. So they must be in the center, and sometimes this is very conflicting, and that's why it's really a question of risks, which I addressed already in the beginning. I think sometimes there are financial risks related with it, but if we can help people out of this. This makes it's very important. And that is, I really think, just imagine the situation in Venezuela. You see this there very strongly, what it happens when a government fails to protect the right to health. And this is a big dilemma, and probably you have to work through NGOs to really help, but it's a public health issue, not only in Venezuela, but in the whole region. So it's in the really interest of all governments to really support the people in the country.
Yeah, maybe just give a bit of a sort of a private sector issue on the governance, because you really raised a very important point, because one of the problems, not just the pharmaceutical industry, but all private sector in the global health area and probably others in certain countries, is that there is not a robust governance within the structure. Yeah, and that makes it almost impossible to be active there. And I think strengthening those governance mechanisms and dealing with issues, and I'll use the word because Dr. Tedros says it now, corruption, yeah, is fundamental, and the governments are now more and more focused on that, and we have to deal with that. So from the private sector, of course, we also have to develop codes of conduct, and our industry is doing that when we have now set up 3 national associations, one in Ghana, one in Ghana, Kenya, and South Africa. These are local operators. We also have to act often as a group is better than not acting as an individual company. And one of the things Access Accelerated, this initiative we've done, one of the things that the government likes and regulators like is that there's actually an industry group, private sector group, that is engaging with them and not individual companies, because that makes it a lot more easier to deal with. And the other thing that's been mentioned, of course, is bottom up. And I cannot stress that more than anybody else has. I mean, it is so important, again, from many dimensions, that the communities are fundamentally involved in this. Yeah, and that's what we're seeing now. People living with NCDs taking more and more a political and fundamental role. And Access Accelerated provides that platform, and is one of the key areas to that. The other thing is, I'm sorry, I don't go on, but communities at a very local level can actually be more reliable than some of the government and institutions as well. And I think a lot of private sector groups like to work at that level as well, as I think, funders.
Thank you. You're beginning to move into health as political and therefore also ethical issues.
Well, it is.
Just quickly, if it's going directly, and then I've got another one at the back. Yeah.
My name is Anna, and I feel myself like the next generation of the functionaries of the global health, because I'm willing to enter the global health department. So the question is, for all of you, maybe you already have the mechanism of improving the trust to create this partnership, the government and the private partnership sector and the organization, because the trust is the basement of this partnership. And as we see from the international situation right now, it doesn't work. There is no trust. So how can you start this if you don't trust each other?
Thank you. So we'll hold that, and I'm going to take another question so we can get a few in together. Please. One on trust.
Hi, my name is Martin Hitziger. I am a co-initiator and coordinator of another R4D project that is similar to Cohesion in some ways. I kind of like your classification of financial and program risk. I would like to ask for a third risk that I see is relevant, and that relates to in how far any of you has experience or interest in partnerships that step out of the comfort zone of Western medicine to take into account that actually integrate indigenous health systems or services that are present in many developing countries. Yet apart from the 2 risks you mentioned, there is the third risk that it's not always very clear in how far this complies, adheres, or is equivalent to the kind of Western medicinal criteria that you would usually use to assess the effectiveness of your interventions. Thanks.
Thank you. Would anyone like to respond? So the first question was around trust, and the second one about other non-biomedical health systems.
Yeah, maybe on trust. I think we have also a dilemma in the northern countries about international cooperation for health. We have interest and we have economic interest. Let me take the NCD issue. Of course, we need mechanism to better tackle NCD management in the southern countries. But think about the fact that, because I'm going to work on tobacco, Switzerland is exporting a lot of cigarettes, and actually cigarettes that we cannot sell in Switzerland because they have contents of chemicals that are not allowed in Switzerland. And we produce a lot of them, and we export them to Africa and Middle East, actually. And so we are contributing to the crisis of NCD. And the amount of benefits that the industry and indirectly through taxes the Swiss government is doing is much higher than all the money that we SDC has in order to improve health in the South. So we have a dilemma of also credibility, because in our governments, not everybody speaking with the same voice. How to improve trust in such a situation? Honestly, I don't know. Honestly, I don't know. We have to work around it. We are here like-minded people, but we have to be conscious that the outside industry, especially the tobacco industry, and sometimes also, sorry to say it, but the pharma industry is not always the nice actor. It can be very, the pharma industry is not, the tobacco industry is not all bad, because I consider that tobacco industry is just bad. It's not a partner for dialogue in global health, should not be. We should not even talk with them, because they just want to make profit and directly kill people, actually. But we have this dilemma and we have to work around it. There is no mechanism to my knowledge.
I will be very short. I try to avoid that big elephant in the room, but it seems, but I feel very comfortable with that kind of schizophrenia Martin knows about. I mean, we know that we suffer from very severe schizophrenia. And there is a lot of political incoherence, but I think one cannot feel, I mean, we cannot, there is an accountability mechanism, and we cannot feel responsible for everything. So everyone has to work, I mean, on its mandate and trying to do the best, and having in mind that there is this kind of incoherence at the, I mean, talking about tobacco, we know the situation in Switzerland. Nevertheless, I mean, the SDC is convinced that what is key is demand from countries, and some countries are demanding to support them to implement the FCTC. This is the case of Bosnia, for example. So what do we do? I mean, we have two options. The first one is to say, no, we are sorry, we want to be coherent. So because we have this kind of dilemma and situation in Switzerland, we're not going to support you. Sorry, the two entities in Bosnia, they really want to implement the FCTC now, and they are putting a lot of resources in that. So it's only about facilitating matching the funds and etc. So the second option is to say, okay, we know that we have this situation, that it's incoherent. One could say, why is SDC supporting the implementation of FCTC in Bosnia while you have that kind of situation in Switzerland? But then we choose and we said, we are needs-based. So our mandate is really to support partners in implementing their priorities. It's not about, it's not about avoiding that. So we have a kind of, we are very flexible in our mandate. So a lot of these kind of incoherences and distortions, we can really, by focusing on the needs of the countries, we can address that kind of distortions. But we will never work in a kind of very clear, environment without any kind of conflict of interest. That's why I'm talking about schizophrenia.
Did anyone want to comment on the second question? Experience before going on. I'm going to take a last round after this, and I've already got two questions.
I will answer, not answer, but give a comment to both. But first, I think Michael was it, huh? Your question, I think about how to include non-biomedical traditional health systems for health, and I think this is absolutely very important. I think as culture is in the center of one of driving elements of the health situation, we cannot just ignore these traditional systems and use them and learn from them as well. It's not only to use them, it's as well to learn. I think this is really an important comment of this on this. And trust, I think it's an important thing. Some things were said here, but I think really important, we really have to be a little bit careful, not just washing this partnership thing always in a way that, oh, it's such a beautiful thing, we all go in partnerships and the industries goes in partnership with governments. We have to look at the power structures behind these partnerships. We cannot ignore them, and there we really have to define what are the roles. A government has another role as the industrial partner in this partnership. The government does the regulation, and the industries has to dialogue how to implement the regulation. The governments, the parliaments have done.
Thank you. I know I've got two more questions already. Would you like to? We'll take them in a group of questions now. The final round.
My name is Sabrina Lanzavecchia. I used to work at the UN in development aid and sustainable finance. I'm more interested in global health for personal reasons, so I want to see if there is a correlation between the two fields. As you may know, at the end of October, there was a big event, a week of sustainable finance in Geneva. And then it seems like the SDGs are on the agenda, not only on the politics, but also on the banking sector as impact investors. My question is about the role of donors, private donors in the global health. Probably, normally your donors are foundations or governments who don't really look for a return on the investment. And whereas a private investor would look for a return, even if he has got an impact. So while maybe it's easier for a potential donor to invest in energy infrastructure or any other sector, I'm wondering, do you think that also a private investor can be interested in establishing partnerships in global health? And have you had experiences already, positive or negative, in this field? Do you think it can be possible? Thank you.
Thank you. And there was another question here. And if there's anybody else, let me.
Thank you very much. Very interesting presentations. I'm Yvette Gonzalez. I'm from the health program at Terre des Hommes Foundation in Lausanne. My question is about what donors are doing to avoid vertical programs at the country level. I mean, we see that in the countries we have a donor that is giving money for malaria, the other one that is giving for diabetes, whatever, and then they give money to implement inside the country similar things. And then we find parallel systems running thanks to money from different donors. Of course, we will say it's in hands of the countries to coordinate and to see, and it's related to what Martin mentioned before, how we can have like a single funds where all the donors are providing, but then Global Fund is not part of it. But then is there a kind of coalition or a conversation or a cross-talking in between the different donors to have a better coordination in terms of what to do at the country level or a regional level? Is something happening on that direction?
And one more question, which I think will be the last question.
Hello, everyone. My name is Tolu Oshibeso. I work for the NCD Alliance here in Geneva. But my question is from the perspective of an African who understands the complexities around political will. And my question is, sometimes when interventions try to, when we try to engage government at the highest level, sometimes there's stiff resistance because in countries they are complex. There's a complexity of, culture differences and priorities are different at times. So I'd like to know if your intervention sometimes target subnational programs, probably with the states, because as you may be aware, the states are sometimes at different levels of development. And while at the national level, it might be difficult to gain traction, at the state level, you might actually find the opportunity to work and start something. So I would like to know if your programs are, open to subnational action, of course, where there are no ethical issues at stake. Thank you.
Thank you. So just to recap, the first one was on financing and the role of private donors. The second are on the ongoing challenge of vertical donors and disease-specific funding. And the third on really bringing into the political dimension here and seeing, I think it's a question probably that you can all respond to. Do you work at other levels beyond the national? So other than going the ministries of health, I suppose. So who would like to begin? Thank you.
Thanks. All three questions are really interesting. The first one, sort of the business case. So building a business case for health, basically. It's really complex, but it's absolutely priority at this stage. It's so important. We're trying to tackle this in the NCD, which is a nice sort of innovation hub for health in a sense, because it is so cross-sectoral and multi-dimensional. And the WHO, this is from a WHO's perspective. So usually WHO is now looking into our government sectors as financial partners. We have to make the case for our financial sectors in government to invest in health. And this is a critical turning point for NCDs. The health sector cannot, and that's what I try to say in one of the slides, cannot deal with this alone. The health sector and even higher levels of the government have to make the case for health, have to have a business case. And we have done that in the NCD. We've tried to develop sort of different investment cases for NCDs. And basically what we're selling governments, this is a fact, that you get $7 of return of every dollar invested if you implement such and such policies, which we call the best buys, with such and such partners and such levels of implementation. So we have built that investment case, which is, and I think I take a little step from what you said. How can we engage financial partners in a financial district, in the financial sector? But we're trying to engage our financial partners in government sectors, which is so much more important and so an underserved area of our attention. So the health sector has to communicate with the financial sector and build that business case. So we have examples, and now we're also doing through one of our other platforms. We are going into different countries. We have different eight or so countries per region where we are building the investment case for NCDs to try to identify what is the context specifics of that broader investment case that I mentioned. So that's just going into the business case of it. And this is not something we're necessarily knowledgeable in yet, but we have now growing financial departments in WHO, economic departments who are looking into that, into the broader agenda, in particular because of UHC. Quickly, I want to go into the siloed discussion. The MDG era was extremely successful in some areas and not so in others. In one area that was successful, it was identifying these priority areas: maternal child health, HIV, communicable diseases, and reproductive health, etc., and some gender issues there. And it was so successful in providing very strong programmatic silos, and which ended up in silos, programmatic attention to these areas with very strong donors that were all the way from high-level policy the discussion all the way into implementation and structures at national level on how to implement these. So it became a very siloed approach. So the SDG has to sort of unravel that and identify how to break down the silos and understand how to implement an integrated approach of health at country level. We are doing that through the primary healthcare approach, people-centered primary healthcare approach, and the UHC umbrella. This is all a unifying framework to then to try to break down silos and understand, an integrated approach to health at country level. I'll leave it there. I don't know. Any more comments here?
Okay, very quickly. There was a question on private investment on, I think, particularly on funding for the health systems and insurance. It's interesting. Yes, there is a growing appetite in the private sector, but there are a couple of important conditions. If you speak to the private investors, what they need to see is, again, significant improvements in governance, and also that there is, increasing political stability in countries. So where there's an improvement of governments, when there's improvement of political stability, and then when there is a commitment towards sustainable economic development, this is where the private investors will start wishing to invest in the health economy, which leads to the point of the concept of health economy. And I think this is one of the most, I think, growing interests is how there is a thinking that the more that we can invest in the health of a country or the health of the economy, is that a healthy economy is a sustainable economy, or a healthy economy is a wealthy economy. But we've got to move that from theory into practice. And again, there is a role both for government and private sector. I think that leads me to another point on UHC. And this is more of I'll say this is more of a personal position, but the key to UHC is actually the financing of health insurance. If people do not have access to health insurance, public health insurance or private health insurance, but public health insurance is going to be vitally important for most people. UHC won't really take place. It's the key. And part of that is a responsibility of government, and part of that is a responsibility of investing more in health. The concept is there should be 5% of GDP invested in health, and a lot of countries are way below that, including countries of significant economic development now. And part of that is to, we talk about North-South for years, and then we talked about South-South. I have to say there's a lot of inter-South. There's got to be a concept of solidarity within countries, between those who are wealthier to support those who are poor, those who are healthy to support those that are ill, and those who are young to support those who are old. If you don't have that concept of solidarity, which of course we've had in Europe, for example, or in Japan, which introduced UHC, for example, during a period in time in which they were economically in a period of development after the war. That won't happen. Which then leads me to a final point that I want to address, is looking at the pyramid point, is that we shouldn't forget that indeed, we're dealing, particularly we're looking from a medical point of view, we're treating people. A number of those people will need treatment, whatever their lifestyle is. There are a number of cancers out there, for example, that have nothing to do with your lifestyle, that need treatment. But there is the importance of prevention, early diagnosis, lifestyle. We all know that. There's an individual responsibility. But there's also the fact that the higher the rates of iniquity, the higher the rates of poverty, those really contribute to ill health, and those have to be tackled at the bottom of the pyramid, which leads me to the final point. Someone was saying, can we have any trust? I like this point that you raised before about, and I may have it wrong, that there is a division, is it a divide ecologically, economically, and spiritually? I found that very interesting. I think the problem is there's a massive divide ethically. I just don't think what is happening with the polarization that we're seeing everything is people are not seeing the importance of the common objective and the solidarity. And until you deal with that, I'm not sure we'll be able to deal with a lot of other things. That was my own personal comment.
Thank you. I'm aware of time, and I'm not doing my job very well at the moment because I'm over. I need to leave a few minutes for David to do his concluding remarks. But so thank you very much for the questions, and of course, thank you to the panelists here. The panelists our panel discussion are as good as the panelists. So thank you very much indeed. I think I'll just leave with one comment before handing over to David to give some concluding remarks, and it relates, Greg, to your comment at the end, actually. And I think it's Kofi Annan who've always consistently said that you can't have development without health, and you can't have health without development, and they're interrelated. And I think that's where the partnerships should all be aiming at least towards driving. So thank you very much indeed for joining us on the panel, and thank you to the webinar people as well. And I'm going to hand over to David now to give some final concluding remarks. Thank you.
Thank you, Claire. First of all, I'd like to thank all of you, all the participants in the room, and all our participants who've been listening online. I'd like to thank Claire for having run this morning session. I'd like to thank Séverin for bringing in a new vision. I'd like to thank all the panelists for sharing your experience, for thought-provoking discussions. I'd like to thank Nadia, Talia, Natalie, and Marina, who've been running around and making this happen, especially the technology element. And I think just as some take-home messages is really, why do we partner? And this SDGs as this overarching framework on why we're partnering, why we're trying to change things, and how within SDG 17 it offers us a tool to do this. But what is at the core of this partnership, and what do we really want to achieve? What about the contribution that when we partner, the idea is that we can't do this alone and we need others to work with. And I really like this concept of partnerships for the public good. And I think it's in the next summary is at the end of the day, I think, as was highlighted by many people, is that partnerships start with people as individuals. And with that, we bring our principles, our values, our culture, our preferences, our inherent bias sometimes, our attitude, and how does that shape the partnership, but also the institutions, organizations, and governments that these individuals are part of. I think we can't generalize that everybody in the private sector is the same, or in governments, and that these organizations also have their own culture, that there are issues of conflict of interest and competing interests between sectors, within sectors, that we need these organizations to be flexible, that credibility has to be there in terms of these organizations and what they bring to the table. And also that in this SDG era, do we need changes in visions and the way that we operate within these organizations, and also changing of metrics in how we assess partnerships or how we assess success of what we're trying to achieve. In sort of looking at the how to do this, there's the need to invest. I think it takes time, it takes money, it takes resources. Séverin in his presentation highlighted a lot of approaches and frameworks that can help on how to partner and create a common agenda, but also that needs to be some rules of engagement. And I think that's an area that needs to be thought of, is how do we develop those rules of engagement with an understanding of the underlying interests that are inherent, but that transparency is also needed. And as was highlighted, the importance of governance and accountability to enable managing of conflict of interest at all levels. And then this issue of power, I think, is really interesting to think about. Power sharing responsibilities, these power dynamics that exist, donor to recipient, north, south, and also within each country, and how can we foster local ownership and this bottom-up and community engagement. And as Claire highlighted, that was one key element of our Cohesion project, was how can we engage populations to develop their own solutions and partner with these populations to do that. And then also move away from these silos, and silos both from a disease perspective, but I think also our silos as academics. How can we move away from our academic silo? How can we move away from a whole variety of silos that build walls around us rather than enable true partnership? And I think also thinking about this is how can we have funders that fund, I mean, as an academic, fund research projects that can have as their outputs not only number of publications or if X target was met, but a successful partnership, and the trust has been built between partners, and that partnerships go beyond just institution to institution, but also between countries, between individuals, and really as a tool to build links between different sectors and different countries. And I think finally, one element was really this element of innovation. And I think it was Greg mentioned improvisation. And I think how can we improvise and be innovative in the way we do things? Issues around co-creation, co-design, these tools such as social labs or the global coordinating mechanisms, knowledge action platform. How can we think differently on how to collaborate? And I think one of the messages I'll take home is also moving out of our comfort zones, thinking about radical changes, collective approaches, and also this dialogue towards a shared vision. And really the idea behind this session, and hopefully future sessions, is to create a space and an environment where the sharing of ideas and dialogue can happen. And I look forward to continuing this discussion with all of you. And also thanking you again for everybody's participation. And for those of you who are available, as I mentioned, this afternoon at 2 p.m. in this room, we have a joint session between Lima, Peru and Geneva on the issue of universal healthcare coverage and primary healthcare. So again, thank you very much, and enjoy the rest of your day and your weekend.